All right, welcome to The Explainer. Today, we're diving headfirst into one of the most intense, high-stakes environments in all of medicine, the trauma bed.
So let's get right to it. We've all seen those crazy medical dramas on TV, but what actually happens in those first critical minutes? Let's push past all the shouting and the chaos. We're going to break down the methodical, almost scientific reality of turning a crisis into a coordinated rescue.
First off, we got to understand what we're even dealing with here. Multisystem trauma isn't just, a broken bone. We're talking about a cascade of crises hitting the body all at once. The cardiovascular system, the respiratory system, the skeletal system. It's a full-on, multi-front war.
So how do you fight a war on multiple fronts inside the human body? Well, you assemble an elite team, and you do it fast. Because the second that trauma call comes in, the clock is already ticking.
And honestly, this is the perfect way to think about it. It is a group of diverse specialists, and every single person has a hyper-specific job. They're all moving in perfect sync, all driving toward one single goal: get that patient stable, and do it now.
And just look at who's on this team. You've got your core group of trauma surgeons, ER docs, and nurses, but you also have specialists like neurologists on call and all these crucial support services, radiology, the lab, respiratory therapists, all on standby, ready to jump in. The key here is that everyone knows exactly what they need to do before that patient even rolls through the door.
Okay, so the team's in place, the patient arrives, now the race really begins. It all starts with something called the primary survey. This isn't some casual checkup. It's this incredibly fast, super systematic process designed to find and fix anything that could kill the patient in the next few minutes. And to remember it, they use a simple mnemonic: A, B, C, D, E, F, G.
First things first, A is for airway. The absolute #1 priority is, can this person breathe? Can they get oxygen in? The team works to make sure that airway is clear, all while protecting the spine from any more damage. Because let's be real, without a clear airway, nothing else they do is going to matter.
All right, so the path is clear, but that's just step one. Next up is B for breathing. Are the lungs actually doing their job? Just because the airway is open doesn't mean the body is getting oxygen. So the team immediately checks how effective each breath is and gets oxygen flowing.
Okay, we've got air coming in, lungs are working. Now for C, circulation. Basically, is the heart still pumping, and more importantly, is the blood staying inside the body where it belongs? They're checking for major pulses and slapping pressure on any major bleeding to get it under control immediately. From there, we hit D for disability, which sounds a little jarring, but it's really just a super quick check on their neurological status. They're looking at pupils, asking the patient to wiggle their fingers and toes, anything to get a quick baseline of how the brain and spinal cord are doing. Then comes E for expose. The team has to get all the clothing off so they can see everything. This is crucial because you absolutely cannot treat an injury you can't see. And while they're doing this, they're also piling on warm blankets to fight off shock. And F, well, F stands for two things: a full set of vitals and family. They're getting that first complete set of numbers, blood pressure, heart rate, to see what's happening internally. And, just as important, they're looking for family. It's about grounding this whole intense medical process in some human connection. And that brings us to the last step of this initial blitz, G, for get resuscitative adjuncts. This is just a fancy way of saying it's time to get all the backup ready to go. They're drawing blood for the lab, hooking up the heart monitor, starting IVs, the whole shebang.
Okay, so that whole primary survey, that ABCDEFG blitz, is over in just a minute or two. The biggest, most immediate fires are being put out. Now, the team can take maybe half a breath and start digging deeper.
So after the primary survey, we move into the secondary survey. And you can really think of it as a total shift in gears. If the primary survey was a flat-out sprint to stop the patient from dying right now, the secondary survey is more like a marathon. It's a careful, meticulous, head-to-toe investigation to find every single injury, no matter how small. So you might be thinking, okay, that's a cool system, but does it work exactly the same for every single person who comes through those doors? Well, the short answer is no. The framework is the same, but the application has to be flexible. Let's take older adults, for example. When an elderly person suffers a major trauma, the team's entire approach has to shift because they're dealing with a whole different set of physiological rules.
An older body just doesn't have the same bounce back, the same reserves to handle that level of shock. But here's the real kicker. Common medications, like beta blockers for blood pressure, can completely hide the signs of shock. So a doctor could look at the monitor, see a normal heart rate, and think things are okay. when in reality, that patient is in profound shock. It's a total game changer.
And what about another incredibly complex situation? A pregnant patient. Because now, suddenly, the team isn't just treating one patient, they're caring for two.
And in this situation, the rule is absolutely 100% clear. You save the mother first. Why? Because the best possible thing you can do for that baby is to successfully resuscitate the mom. A stable mother gives the baby the oxygen and blood flow it needs to have the best shot at survival. So when you step back and look at the whole picture, what you see is this incredible system. It's a process that takes the sheer, terrifying chaos of a life-threatening injury and, in just a few minutes, turns it into a highly coordinated, systematic, life-saving machine.
But before we finish, there's one more number we really have to talk about. It's a really sobering statistic that casts a shadow over so many of these events.
40%. That's how many of these traumatic events involve alcohol. And when you factor in other drugs, you're looking at well over half of all major traumas. It's a staggering number and a powerful reminder that while these medical teams are nothing short of heroic, prevention is a massive part of this story.
And that really leaves us with this final thought, right? We've just seen the incredible, synchronized effort that goes into saving a life in those first 5 minutes. So how does knowing all of that change our own perspective on the small, daily choices that could stop that 911 call from ever being made in the first place? It really goes to show you that the most effective form of trauma care is the kind that happens long before an ambulance ever has to be called.